With me, Dr. V.K. Paul, member of Niti Aayog. He's handling the health and nutrition vertical over there, and he's focusing particularly on Poshan Abhiyan and Ayushman Bharat Yojana. Thank you so much for joining us, Dr. V.K. Paul. And obviously, when we talk, I'm going to start off with Poshan Abhiyan. I'm going to talk about Prime Minister Ayushman Yojana and what has been your contribution and how does this scheme, these two yojanas, carry forward for a better India, for a healthier India, and particularly when we want to talk about the last mile connectivity, the last mile, the person living in the remotest village of our country receiving these benefits from these schemes.
Under the guidance and leadership of the Honorable Prime Minister, in 2018, the two schemes that you mentioned, actually there are three, I'll come to that in a minute, were launched. Poshan Abhiyan was focused and continues to focus in its 2.0 version on improving the undernutrition status or the nutrition status of children and mothers and reducing undernutrition, stunting and wasting. The Ayushman Bharat had two components to this, and they were announced simultaneously in the budget speech of the Honorable the then Finance Minister Arun Jaitley ji. The first component, and very important component, often and at times less often spoken, is the Ayushman Bharat Health and Wellness Center mission, which is strengthening India's primary health care in a very comprehensive, transformative way. We call these centers now Ayushman Arogya Mandirs. And the second scheme is Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, under which a large population of India is covered for secondary and tertiary care hospitalization to the tune of 5 lakh rupees per family. Both these schemes and Poshan Abhiyan touch the very lives of the citizens of India in a very big way. These have changed the indicators of our nation. They have made a significant difference, and above all, they have created a platform now in a very big way to move forward with even more aspirational journey for health, nutrition and wellness as we move on the path of Amrit Kal toward Viksit Bharat.
You spoke about nutrition, and there were a number of these case studies that I ended up reading and going to the people and going to the ASHA workers and the Niksha workers, the Niksha Mitras that have been appointed, and their primary job has been for eradication of tuberculosis, and particularly the nutritional aspect that they look forward to, ensuring that the people, the patients, the beneficiaries are provided with sufficient amount of nutrition. Are there some similar schemes or similar programs that are going to be launched, are already being launched by the government of India and going to be taken forward when it comes to nutrition, but particularly specific diseases that may be a problematic issue in the larger percentage of the country?
Well, nutrition is a very fundamental necessity. Undernutrition leads to multiple problems, including health issues, but also learning, development, performance, productivity, and the overall well-being of the person. Overnutrition has its own consequences, but in the context of disease, nutrition becomes even more critical. It is now well known that for a chronic disease such as the tuberculosis, on which there is a clear program through Jan Andolan, undernourished individuals will linger with the tuberculosis longer, they'll have adverse outcomes, and they'll succumb, and their recovery is hugely affected. And because we have considerable number of such patients having low nutritional status simultaneously, therefore nutrition is considered scientifically to be an additional intervention in addition to the drugs and the medicines and the other support that you get. And to build a Jan Andolan around that and to involve society in supporting the nutritional care of patients of tuberculosis, the Niksha Mitra Karikram was launched, in which the volunteer individuals are offering nutrition by connecting with the health system. They offer certain amount of money that is required for nutrition package that will be given to individual patient for a finite period of time, typically 6 months, and then you can renew again. So this will help and has helped tuberculosis patients to be receiving better nutrition, which is overall a good thing to happen, but in addition it is helping better recovery of these patients. Similar approach may be considered in other conditions. We have discussed how this can be considered for seriously affected sickle cell disease patients, and there are other ideas around this.
There was a fascinating concept that has now been implemented, giving the beneficiaries medicines, providing them, selling the medicines at 1/3, 1/4, and sometimes even 1/10 the cost under the Aushadhi program, the Aushadhi Yojana of the Prime Minister. In these Prime Minister Aushadhi Kendras that have been set up across the country. I want to understand the mathematics behind it.
Very simple.
And how is it possible that the government is able to provide these subsidized medicines to the poor, and we are catering to a large percentage of the population?
It's a very fascinating model. We know that medicines in our nation, the ingredient is the same. It goes through quality filters, but then when it is sold under a brand name which is allowed for business, and economy and other things, it is often sold at a higher price. If it is a non-branded generic ingredient itself, the generic medicine, without a name, just the salt name or another name, then the price could be much lower, because when the brand companies are selling through their brand, they do marketing in such a way that they attract people who are willing to pay higher price for the same thing. So say erythromycin could be available, the generic version of that is available, the salt is available, so let's say for a cost, say 10 rupees. But the branded version put into the market by some of the well-known companies or many such companies may have a price which is something like 100 rupees, 10 times, even more. Now this is a reality. What the government does is that we procure generic medicines which are of high quality, and quality checks are made before they are put into the system. Our agency procures it under the Department of Pharmaceuticals, and then these generic medicines are channeled through Jan Aushadhi outlets or Jan Aushadhi Kendras, which is a business franchise by individuals who decide to take this franchise from the government. So we supply them the medicines, and they sell the medicine at a pre-decided price, which is linked to the low price because it is a generic medicine being bought aside, but the government system ensures that they are of high quality. So that's the essential model. But no, it's not over. 1,700 plus medicines, more than 250 surgical commodities are being channeled currently through this system. There are 10,000 Jan Aushadhi Kendras. We plan to reach 25,000 as per the direction of the Honorable Prime Minister by 2025. And the drugs, the medicines that are available are 1/10 of the cost, 1/20th of the cost, without any compromise on the quality. Quality is assured and reassured in the system. When you do this, there is a saving to the people. Their out-of-pocket spending for my medicine, instead of spending 100 rupees, I am now spending 20 or 10 or 7. And this saving to the people is to the tune of $2 billion in the last few years. That's the amount of saving that is accruing. So it's a fascinating model, and it compromises the quality in no way at all, and it improves the access to medicines by the people, which is a very major reason for out-of-pocket spending on health.
there is going to be allocation when we talk about the healthcare sector in our country. It is going to be potentially be amounting to over 200 billion US dollars in the next few years. Keeping in mind there is quite the discrepancy in certain parts of the country which are very well established, well connected with best of the best healthcare systems, healthcare services, hospitals, healthcare centers. But then there is also the latter part of the problem, which is the rural areas or the remote areas, and where you do not even have hospitals, you don't even have healthcare centers. Now there has been an initiative made by the government. We have been seeing these announcements, hearing these announcements that there are a number of AIMS hospitals that have been opened up. What more is the government doing to ensure that the healthcare service is provided to every single individual, and most importantly, the poor, the needy, the sick?
So let me do this in at least two ways. There is, because you are asking a question which is very big, what all is being done. But let me just pick on two pieces and then we can build on the story in more detail. So let's talk about access to health services. Through the Ayushman Bharat Health and Wellness Center mission, Ayushman Arogya Mandirs, the whole endeavor is to strengthen the primary healthcare system of India as it has never been done so far. We have had PHCs, we have had sub-centers. They were thin in terms of their human resources. They were delivering a good job, but focused predominantly on maternal and child health and family planning, and rightly so, because these were our top priority, uncommunicable diseases. But now the range of services will include the non-communicable diseases, hypertension, diabetes, cancer, and then maybe even more. It will cover mental health, it will cover care of the elderly, oral health, ENT. This is our vision. Non-communicable disease efforts are already on in a very big way. Screening is happening. Pathways are being made to put those who have hypertension and diabetes on treatment. So we are building that system. But building it with full earnest. 161,000 Ayushman Arogya Mandirs, the health and wellness centers, have been made operational since 2018 in a record time. And it is no joke, because it's not just changing the name. These are those sub-centers and PSCs, but they have a new worker. There's a new worker deployed, a community health officer, over 1.5 lakh are deployed over such a short period of time after due training. Now that's a revolution, because any country, it's not easy to have 150,000 new workers deployed over such a short period of time. Telemedicine is a norm in all these centers. Drug availability is being ensured, because drugs mean a lot to the community. So in the sub-center level health and wellness centers, there are 105 drugs that are meant to be there all the time. 172 drugs when it is PHC. 14 diagnostics in the health and wellness center, sub-center, and 63 diagnostic. The short point that I am making is that there is a revolution happening above all in the sphere of primary health care to take services, as you asked, closer to the people. More important part is that this is the platform which is now ready for us to make it much more comprehensive, have the things that are not yet there, for example, mental health, which is gradually being loaded on this, care of the elderly and so on. But this platform is now ready. In these next 5 years, you will see the fullest manifestation, and we need private sector, communities, academics, researchers to all join hands to make us successful. Our policy, national health policy, envisages spending, the government health spending to the tune of 2/3, above 60%, 62% on primary health care. So above all, primary healthcare revolution is unleashed, and you will see the results. You talked about AIMS, so that's a tertiary system, the other end. Then you look at the strengthening that has happened by way of critical care blocks and mother and child blocks and upcoming pediatric care units in every district and so on. So at different levels of primary health care, different level of public health system, there is a strengthening. And do not forget the medical colleges, which were 387, now 706. Government medical colleges were 181. Now addition 201, more than double. So all this is a big infrastructure that has been created and being developed. Very briefly, let me touch on the human resource side, because other building blocks. What did we do? Human resources are witnessing revolution for the healthcare. I mentioned about the new medical colleges, but what does it translate into? The pipeline for MBBS doctors is more than doubled. From 51,000 undergraduate seats, today it's 108,000. Postgraduates more than doubled. From about 51,000 PG seats in 2014, today, so 32,000 PG seats. Today we have 68,000 PG seats and rising. And we'll even more progress is likely with the new PG MSR that has come up. Human resources are critical. Nurses, the new law has been brought in for the allied health professionals such as physiotherapists, dietitians and others. Law has been brought in, it's being regulated. So there are transformative reforms in the sphere of human resources, and the availability is rising. We have crossed the benchmark of allopathic doctors, 1 per 1,000 WHO, which was far, people would think when it will come. It has happened. If you add Ayush doctors, it's already 1.4 per 1,000. But going into Viksit Bharat, this has to be so much more. We should envisage, and we will envisage, 3 per 1,000 doctors, which means the journey must go on. We need a better proportion of specialists, not just doctors, but the right mix of specialists vis-a-vis general care doctors and so on. So all those efforts are on. So this is just a two facets of the health system that I'm referring to. Happy to answer more questions.
Well, I wish I could have continued this discussion because it's a fascinating aspects that you've shared, particularly in terms of the statistics and what is the aim of the government in the next few years to make India a healthy nation and make every single poor in our country a healthy human being and a healthy family, therefore. And on that note, I am very glad.
No, but I must add one more part to this. You heard about digital health?
Yeah.
So there's a revolution. Telemedicine, digital health is a revolution. But I must touch upon one more through, if you give me a minute to share. We must also look at the other determinants, the indirect determinants of health, often not talked about. Look at the achievements. Whole of rural India is today ODF, open defecation free.
Yes.
11 crore plus toilets have been built. 10 crore LPG connections have been given, so indoor pollution had gone. Women have more time. But something again which is often not connected to health is now the revolution of having, a safe and potable and, safe water supply through tap into the households. From 17% coverage, today we are 74% coverage. And it will reach almost a full saturation in time to come. So imagine the impact of these things on health. There are challenges. We must be mindful of the fact that the non-communicable diseases load and the burden that we have, which happens when you move in the direction of development, has to be addressed systematically, but in a holistic way, engaging also the Ayush systems, engaging the digital capabilities, engaging the people of India. We look forward to a much better world. The expectation would be, and that's my last part, just to say where we want to be. 2047, the life expectancy of Indians should be more than 85. Today it's 71. Healthy life expectancy today is 60. It should be 75. And we are in that direction. But collectively, let's move in that direction. As with people, as a partnership of state and the union government, and really every one of us, and including media, have to play our own part. Thank you.
Absolutely. A huge round of applause for Dr. V.K. Paul for enlightening us with all this information, and all the very best with the big, massive plan of the Government of India to taking India to the next level of being healthy.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.